So this video is for lash lift, and we're going to start the video as if we just arrived to work. So we would wash our hands at the sink upon arrival. We're going to wet our hands, and we're going to find liquid hand soap about a coin size, and we're going to wash our palms together down to our wrists. We're going to wash the back of our hands down to our wrists. We are going to wash our fingers and the backs of our fingers. We are going to wash our fingertips and nails. We are going to wash between our fingers and our thumbs. We're going to wash our thumbs, and we're going to wash our wrists. And we're going to do all of that washing for a good solid 20 or 30 seconds minimum. And then we're going to rinse everything underneath the water. When we feel like we've had a proper rinse, we will grab some disposable paper towels or a towel, turn off the faucet, completely dry everything off. Throw those paper towels in the trash, and if it's a dirty towel now, it would go in a closed container until it's time for laundry. And then you're going to find your 70% ethyl alcohol hand sanitizer, and you're going to sanitize those hands. And then you are going to prepare your room for your client, which is coming in for a lash lift. So let's just review how you prepare your space. So you're going to make sure you disinfect your workstation, bed and equipment using a disinfectant wipe, following manufacturer's instructions. You're going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. You're going to dispense products needed for the service. So you'll prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray. Or you can remove product with a disinfected or clean single-use spatula. You'll close the lid to the product and set the portion cup tray on the tray. You're going to drape your facial bed using one fitted sheet, one flat sheet, and 3 towels. You'll place clean laundered sheets down on the disinfected facial bed, placing a towel horizontally at the head of the bed. You'll lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client, and you'll save the third towel to lay across the client's décolleté. You also have the option to use disposable table paper as a drape to drape the bed if you prefer. So we have set up our room, and I want you to see that I've already prepared my tray for the service. So we're going to just review what I have. So I have on my tray cotton rounds, 2x2s and 4x4s. I have wooden stick Q-tips. I have a couple pair of disposable gloves. I have water, makeup remover, a gentle barrier cream, something like petroleum jelly or Aquaphor. I have lash lifting lotion, and then I have setting lotion. I have disposable mascara wands. I have my rods for the lash lift. I have lash glue. I have brushes that I'm going to apply my lifting lotion and my setting lotion with. I have the tool that lifts the lashes with the glue. And I have, of course, disposable under eye pads. And so I've got everything that I need here for my service. I'm just going to check my glue because it's been giving me challenges with my mannequin. Unfortunately, it's not the best product. So I'm just going to make sure it's nice and fresh. Doesn't have any buildup or anything on it. And this is just part of that setup, setting up your room, setting up your tools, making sure you have what you need before the client arrives so that you have none of this to do. And if the client, after the client consultation, is definitely prepared for this service, then we will 100% do it, and we're not wasting any time getting our stuff ready. So hopefully that is good. So we're going to need to meet with our client to do a client consultation. For this particular service, they have been told upon booking the service, so ahead of time, that you have some specifications after a lash lift that you need to follow. For example, you cannot get your lashes wet or wear any makeup for 48 hours. So they do not want to get a lash lift, let's say, the night of a party where they want to do a lash lift for the party. They need to get it done a couple of days ahead of time so that they can actually wear makeup for their party, etc. So just, you've communicated that ahead of time. Your client's aware of that they won't be wearing makeup, which is why they've booked it at this time. So you're going to do your client consultation. And just note that at this point, I would be washing my hands, which you saw me wash my hands upon starting the video. I'm going to wash them again before we put gloves on to start the service. But I always approach my client with clean hands. That's never a question, never a concern, never a wonder. Every single time I see my client, my hands are perfectly clean. And we are ready to go. So I'm going to tell you what you do in your client consultation. Just going to get my booklet. I'm just checking all of my implements, making sure everything is just so perfect. So you're going to meet your client, greet your client, and escort them to your work area. You are going to assess the client's current style and determine the client's preferences. You'll assess the client's needs, and you'll assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, something like lice, to prevent from safely performing the service. You'll assess the client's consultation form for any medications and products used within the last 72 hours, and you're going to consult on any known allergies. You will consult with the client on any facial surgeries within the last 3 months, and if the client is under a physician's care. You'll assess if the client is prone to cold sores or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. If the client is free from the above contraindications, you can move forward with the service. Unfortunately, our client hasn't used any of those products or hasn't had any injections, doesn't have any kind of irritation, there's no infestation. Everything looks really, really good, and she's very excited about the service. So we're going to get her comfortable, and then I'm going to wash my hands again. So she doesn't have to disrobe for this service. She's simply going to lay down on the facial bed. I've draped her with the blanket. She's in the sheets. I'm going to get a rolled towel here to place under her head for some more comfort. I have a hairnet right here to keep the hair out of the face, away from the eyes. And then I'm going to drape this towel across her neck and décolleté area, just because for my mannequin that shows, but even if she had clothing on, I would just want to give it that additional coverage so that nothing gets on your client, which nothing will, but we just want to double, triple, make sure always that they're covered up. So the first thing that we need to do is wash our hands so that we can move forward. So I'm going to go to the sink, I'm wetting my hands, and I'm getting that coin-size liquid hand soap, and I'm going to rub my hands together down to my wrists, and I'm going to wash my hands on the backs down to my wrists. I'm going to wash my fingers, and I'm going to wash the backs of my fingers. I'm going to wash those fingertips for sure, and nails, and then I'm going to go between my fingers. I'm going to go between my fingers and my thumb. I'm going to go with my thumbs here. Wash my thumbs, I'm gonna wash my wrist. And I'm gonna do all of that good proper wash and rinse, wash for 20 to 30 seconds, and then we're gonna give it a good thorough rinse. So minimum 20-30 seconds with the soap, and then get everything rinsed off really good. When you feel like you're rinsed, you can grab disposable paper towels and turn the faucet off, dry those hands off, toss the towels in the trash, and then get your hand sanitizer. 70% ethyl alcohol, and you're going to sanitize your hands. Now you can also use a clean towel when you turn off the faucet with the towel and dry your hands. Then it's dirty, so you'll put it in closed container until it's time to do the laundry with the other dirty laundry. And then once your hands are dry, you're going to get your good old disposable gloves and you're going to put them on because you're going to wear gloves for this service, no doubt about it. And then what you're going to do first, right away, straight from the jump, is we would remove eye makeup remover. And so we're just going to put a tiny bit of makeup remover on our cotton rounds because she's a mannequin. So I put a little bit of double-sided tape on the lid to hopefully help the rods stay down, although we'll see. It's not been working that great. So I'm going to put my cotton rounds over her eyes to help facilitate the cleanse. And so we're just going to be removing eye makeup. We want to make sure there's no moisture or eye makeup anywhere on her eye before we perform this service. And then I'm just going to dry everything off real gently. And Sue has been a trooper here, lash lift after lash lift. Hopefully this will be the last video of lash lifts for this week so she can get a little break on them, because it's not doing any justice to her poor little lashes here that are not real. But everything's dry. So what I'm going to do now is I'm going to take a little bit of that. Let me just take this mascara one because there's a couple lashes sticking to that double-sided tape. Okay. A little bit of that barrier cream underneath her eye because I'm going to put eye pads on and it helps it stick better. It also helps protect under the eyes. And when you put your eye pads on for a lash lift, you're actually going to completely cover the lower lashes up. That's important to note. You're going to completely cover up the lower lashes. So I'm taking it in, I'm going up as close as I can to those top lashes because we're lifting the top lashes only and we're covering up the bottom lashes. And the client will have her eyes closed for the rest of the service until you tell her to open them up. So I just tell her now's the time, you get to just relax. To relax for the rest of the time. And once those eye pads are on, the next thing that you're going to do is place your rods on. Now, I'm going to actually, maybe I'll do just a tinge of the glue on the bottom. I don't think it's going to help it stick at all, but we'll see. Since it's sticking to everything else, you never know. Maybe it will. I'm going to put this side on the double-sided tape here in the center. I'm going to try to get it as close to the lash as I can. And I'm going to press it down for 5 to 10 seconds. What has been working, or what seems to be working, is when we actually put the lashes on the rod, it seems to hold the rod down. So we'll hope that that helps. But you never know, this might work, I don't know. Seems like it's working a little bit, so who knows. Maybe it'll help when we put the lashes on, so I'll try. Excuse me, a similar process. Sorry, I'm just going to grab a sip of water so I'm not choked up. Thank you. I'm going to try the other side. So I'm going to put a little bit of that lash glue on her lid as well. And I'm just going to start working on this side, and we'll see how it goes. So you're going to then start gluing the lashes to the rod. So what I'm going to do is I'm going to start from the outside corner and kind of work my way in. It's a little awkward with the mannequin just because I have to kind of hold that rod down. It's not really glued down. It would not be that situation with the client. Just note that as you watch me hold the rod, you will not have to hold the rod. So we're just going to see how it goes here as I start to apply the lashes to the rod. Hopefully the rod will stay down a little bit better. That's what's been happening in previous videos. It seems to stick down a little bit better when I apply the lashes to the rod. And one thing to note here, when you're applying the lashes to the rod, you will be wanting to comb them out nicely and line everything up nicely, because however you stick them to the rod is going to be how they stay when you put that lifting lotion on. So I take the time to make sure that they are going in the right direction, like up towards the brow, that they are not crossed over each other, they're not clumped together, that they are really in a nice, pretty pattern like a normal lash would be, so that you know when that lifting lotion gets on them, that it's going to hold them in place in a nice way. So I do take my time here and I'm more careful. So you just have to know with your lash lift that just give yourself enough time. It's going to take time. It's all part of it, in order for it to come out the way that you want it to come out for your client. But like I said, it is a little bit of a different process that you're watching, because I'm having to hold the rod down. I'm mocking that a little bit because it's not going to stay down on her like it stays down on a human. And even with the double-sided tape, it doesn't really stay on her. And I tried to put some of the lash glue. That didn't seem to help either. I thought, because it was like seriously hardcore lash glue, that it might work, but it doesn't seem to really be helping. But it might, you never know. And also, you know, these aren't real lashes either, so there's like a whole lot of things at play here. It did help a little bit. It does help a little bit when, for the mannequin, when the lashes are actually stuck to the rod, it seems to hold the rod down at least a little bit better. The only downside with this particular glue, well, there's a lot, but once it's on, you can't really fix the direction of the lash, or you can't really move it around. which you would need to be able to do to make your lashes look exactly how you want them for the client. Like these need to be separated right here, and it doesn't want me to separate them right there. There. Okay, I'm going to go to the other side. Okay, so I have applied my lashes to the rod, and they are on it. And so what will happen now is you're going to want to apply your lash lifting lotion. I'm going to use a brush to do that. And I'm going to start at the root of the lash and work my way up, but only 3/4 of the way up the lashes. The very end of the lashes is the area that's going to shed the first, and it's the weakest. So you want to make sure that you don't take it all the way to the edge because you could damage that part of the lash. So I'm going to start here at the root and then kind of blend up, but only that 3/4 of the way up. And I'm going to go to the other side. And then when you get that lash lift lotion on there, you're going to follow manufacturer's directions, of course, but we're going to give her a little privacy here. So we're going to cover the eyes and then give it a minute here to process. So we are going to go over those manufacturer's directions. Of course, it would be different for everyone. We're going to say that this particular lifting lotion is going to take 5 to 10 minutes to process. Just note that some can process as fast as 3 minutes. Because we're doing a video, we are not going to sit here and wait for 5 to 10 minutes to pass. So we're just going to go ahead and take off the lash lifting lotion as if the 5 to 10 minutes had passed. So we're going to take that off. And now I'm going to remove the lash lift lotion. So I'm going to start with dry first and a gentle press up and out. And just so you know, take your time, and if you have to do it multiple times, you can. I'm going to start dry, and then I'm going to go in with a damp remove. And you may have to do up to like 3 passes, as they say, or 3 different times to make sure you get it all off. Just be gentle and take your time. So like I said, I'm starting dry, and then I'm going to go in after I get it off dry and then remove more damp. And now I'm going to go with a little damp wipe to make sure I have all of it off. And now I need to apply the setting lotion. So I'm going to use a different brush, apply that to both lashes, both sides of the eyes. And then I'm going to do that same nice little gentle cover. Give her a little cover there, a little relax. And for your setting lotion, once again, it's all based on manufacturer's instructions, but we're going to let our setting lotion sit on there for 5 minutes. And obviously, because we are doing a video, we're not really going to let it sit on there for 5 minutes, so we're going to go ahead and take it off, but just pretend as if that 5 minutes has elapsed. And I'm going to start the same way I did before. I'm going to go dry, then damp. So a dry wipe, then a damp wipe. And now I'm going to go damp. And you may see when you start to go in with a damp that the lashes will start to separate from the rod. That's okay because you're getting ready to take it off. So when you go in there with a gentle damp, if some of the lashes separate from the rod, that's just fine. You're going to let them do that because this is how you're removing not only that setting lotion, but you're removing the rod, the lashes from the rod rather. And you'll be able to do all the final stuff after you get all of the lashes, etc. off. So I'm just taking it wet, did the little damp first, and then I'm going to get a damp wooden stick Q-tip to really try to get the rest of it off so that they start to release, because they are definitely releasing now. So I'm going to go ahead and grab that Q-tip, just if there's any ones that don't want to come off. So I'm going to help that right along with a little bit more of a wet. And that will help the glue release. Tell you what though, this glue, ooh, loud. There's a ton of it on our lashes. So, okay, these lashes, so you can take off the rod, and you can also gently slide off the disposable eye pad. And I'm just going to get a damp wipe in the hopes that I can get off. I'm going to go underneath for that cream, and I'm going to try to get a little bit more of this lash glue off, which obviously this isn't going to happen for your client. If for some reason it did, you would just really take your time gently to remove it. I'm going to use a mascara wand in a minute too. I'm just trying to wet it as much as, or dampen it I should say, not wet, because I'm not trying to get water in her eyes, but dampen it as much as I can so that I can comb it off the lashes. You wouldn't have to go to all this trouble, but I definitely will be treating my mannequin Sue like she's a real client and taking good care of her like I would anyone else. I would remove everything that's on her. I would not want it to stay on her. Glue is just extremely frustrating. As good as it's going to get on that side. Okay, so other side with our little damp first, and then we'll get our wooden stick Q-tip. So remember, you're going to see the lashes when you do your damp clean. Probably some of them will want to go ahead and come off the rod, which is just fine. And then I'm going to go back with my, of course, my wooden stick Q-tip. But really, I'm making sure that I have the final setting lotion removed. as it's removed from the rod, we will remove the rod and the disposable iPad because we're going to dispose of it. And once again, I'm going to find a wet wipe here to damp to get underneath and get some of this glue that's all over her lashes. This side was a little bit easier to get off, which is really good news. And let me just dry her off nicely. Make sure there's nothing on her that shouldn't be. And then you will be presenting this gorgeous lash lift to your client who just loves it. And it's at that point that you could, she didn't have to disrobe for this service, so you could help her kind of get up and remove the towels, etc. And then you're going to remove your disposable gloves because they're going to go in the trash, and you're going to go over all the specifics that you need to talk about with the maintenance and aftercare. She may want to go ahead and rebook for her follow-up because she loves this service, so you're going to want to get her scheduled out so that she maximizes the results of it. Re-emphasizing the fact that she can't get her lashes wet or wear makeup for 48 hours. Then you will get her checked out and on her way, and everything is a win-win. And then you have to get back to your room straight away because you have to set up for your next client. So when you get through with the client checkout, the booking appointment, follow-up, aftercare, you'll go to your room and you're going to discard any single-use items that you have not already done. And then you're definitely going to find those implements and all those dirty implements, and you're going to put them in a closed container and label them to be disinfected. You will get all of your sheets, your bedding, the drape, whatever you used, and you're going to put it in a closed container until it's time for laundry. You will then get a proper cleaning agent. You're going to read manufacturer's directions, and you're going to follow manufacturer's directions for mixing and usage, and you're going to wipe down your workstation in your area to remove debris. Then you're going to find your disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting. You're going to definitely need to grab another pair of disposable gloves, and you're going to follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You'll disinfect electrical equipment and store in a clean area separate from other implements. Then you get to remove those gloves and throw them in the trash. You will need to wash your hands. So go to the sink and wet your hands. Find that liquid hand soap coin size, and you're going to wash your hands down to your wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. Wash your fingertips and nails. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs and you're gonna wash your wrists. And you're gonna do all of that proper wash for a minimum of 20 to 30 seconds, and then rinse thoroughly under the sink. When you feel like everything is properly rinsed, you will find either disposable paper towels or a towel, turn off the faucet, dry your hands with those towels, throw the towels in the trash, and if it's a towel that's now dirty and it needs to go in the closed container with other laundry, get your hand sanitizer, 70% ethyl alcohol, and you're going to sanitize up those hands. And when you have sanitized your hands thoroughly, just like you did when you were washing your hands, it means that it is time for you to move on and get ready for your next client and your next service. So that concludes your lash lift video.